1% of the population has schizophrenia, and another 3% have other serious mental disorders. One of the most debilitating problems facing these patients is the alteration of social cognition. That is, the difficulties in recognizing emotions and facial expressions and tone of voice, and in recognizing in conversation the intentions of others, irony, and social faux pas. With these factors in mind, we have developed e-motional training, an online rehabilitation program scientifically evaluated and aimed at patients with schizophrenia, bipolar disorder, autism spectrum disorders, among other pathologies. E-motional training has two distinct objectives. The first being the rehabilitation of emotion, recognition, and social perception. This includes self-tests, tutorials, and many games of eyes and mouths, matching, micro-expressions training, prosodic training, body language training, and an original miming game. The second objective being the rehabilitation of the theory of mind and social skills. Our system provides 2 short films, one animated and the other with actors. The scripts are filled with misunderstandings, insinuations, irony, social faux pas that the patients must recognize, and if they fail, they are presented with hyperlinks to help them to understand their errors from the metacognitive point of view. The icing on the cake is a video game called Second Chance, in which the protagonist, a naive and socially awkward bellboy, on his first day of work is faced with countless social dilemmas, both with his colleagues and with hotel guests. He will have to learn from his experience if he wants to win the golden keys and the love of Isabella, the receptionist. The platform is gamified. It saves the results of each user, allowing statistical analysis to the therapist and access to simplified information for the patient. In the validation process, a pilot study and a multi-center randomized clinical trial were conducted that confirmed the program's usefulness to improve emotion recognition and theory of mind in patients with schizophrenia. The program is funded by the Galician Health Services and sponsored by Janssen Laboratories. The team is directed by Professor of Psychiatry at the University of Santiago, Alejandro Garcia Caballero, in collaboration with psychologist Miriam Vázquez Campo, neuropsychologist Yolanda Maronio, and economist Joan Bazara.